Easthampton Mayor Nicole LaChapelle is a member of Massachusetts Governor Charlie Baker's advisory board, which has been tasked with working on how to open up the state safely after stay-at-home orders end. I spoke with LaChapelle to discuss the board's work and what they're finding out as they consider how to reopen Massachusetts.
What we captured there was what we were hearing from industry as well as medical professionals and not-for-profits who had presented to the advisory board starting day one. It was announced of what we're seeing, what we're hearing, and the expectation as far as need for PPEs, as well as health indicators that would be important for each industry, getting ready to tie that to very specific health indicator and metrics to gauge what can happen in the different phases of the plan that will be released on May 18th.
I know, probably, given that those are very different industries with very specific individual needs, is there anything you can say broadly about what you're hearing? Is it these industries saying, okay, May 18th, that report's going to come out, the light switch is going to get flipped and we want to be open and running? Or is it something more moderate, more phased than that?
So from the industries and the not-for-profits, I really give them a lot of credit for thinking through what they would need, what is particular to their industry, and this idea of a light switch just going on. They're very cautious and moderate in their approach and the expectation what they'd like to see on May 19th. My feeling is, from looking at reams of data and reports across the board, including from DPH, as well as Mass General Hospital, the Bay State systems, that moderate approach is conservative as best. And any light switch that would flip on May 19th would have to be tied to the health indicators that really we're still waiting for them to become more predictable and stable. I don't expect any major blockbuster shifts in doing business or not-for-profit care and services on the 19th, simply because we're seeing more and more data that says we need a little more time.
So is there an industry in particular that you do see opening in some shape or form on the 19th and moving forward? Is it, that might take priority over that nonprofit sector that you said, you don't think there's going to be a big shift for them on the 19th and moving forward?
Yeah, and I think that there are many industries the same that won't see a big shift. Right now, without the updated health metrics, it's very difficult to pinpoint an industry that may open a little bit that's completely closed, or an industry that has a very small sector of that industry that's open and expanding that without the update from DPH and Secretary Sutters. The advisory board is certainly expecting more information. The society behavioral interventions are so crucial, and trying to factor that into models, but also developing treatments also affects what we're going to see as far as number of new infections. And of course, testing and contact tracing is absolutely huge. And each industry and not-for-profit sector that has presented to us, it all has this underlining foundation of consistent access to PPEs, as well as testing, as well as contact tracing. Those are three across every single presentation, the bedrock of those presentations, that these industries and these services rely on testing. They rely on consistent supply chains to get PPEs, as well as contact tracing. I can't say that enough.
the data-driven approach that you've talked about, the committee, and you specifically wanting to have more information on, the governor certainly advocated for that, been very clear throughout this that is what is driving this train while people are eager to get back to work. The economy obviously has taken a huge hit here, and it's important to get people back to work. Those businesses back open. Data is the first thing the governor's looking at. Sounds like you agree with that. Are there members of the advisory committee who've said, we don't necessarily agree with that? We want to be more bullish on this. We want to get back to be open.
I would say actually to the contrary. I don't think any member of the advisory board walked in saying, we got to get this done and we got to open things up. I think and I can speak for myself, but also just what other advisory board members have said during hours and hours of us listening to presentations, but also working together. Everybody is holding the position that I just stated around consistent PPEs, around testing, around contact tracing. It's really starting to become abundantly clear on the advisory board that any industry needs those three things to successfully open. And we're all extremely aware of the possibility of having to reclose certain industries or parts of the economy or society, again, if we see an uptick in cases, whether that's a hot spot or just overall trend. We also are very concerned as a whole around the inequity of where we're seeing infection, where we're seeing lack of treatment, and it parallels health trends that we saw before we were in the middle of a pandemic, and the equity of how to get those three key services, supports to everyone. It really, one, it's social equity and it's economic equity, and it's really just basic human rights.
For you, the mayor of a small city, about 16,000 people there in Easthampton, are there things you're bringing to the attention of your fellow committee members, advocating not only for Easthampton, but many of the other smaller communities in Western Massachusetts?
Yeah, I mean, what I've been able to bring back is best practices from different industries that are looking to open at some point of this phased plan, that may have different resources to take a look at what we can do in Western Mass with smaller communities, but also the bigger communities. All of the municipalities in Western Mass, not unlike the rest of the Commonwealth, are under tremendous siege. And the capacity of what municipal governments can do is always limited by their economic structure and the number of people and who lives and what they do for a living, and just providing those core services. So the advisory board has really allowed me to bring back some key best practices, but also practices that have proved not to be so effective unless used 100%. And that's been really helpful. As far as we're getting used to, or this idea that the economy will start opening once we get these metrics firmly in place.
We look at some neighboring states and we see they are starting to reopen, and look across the country and many are seemingly fully open. I talked to a relative who lives in Florida, and she said she felt like it was like New York City as she was driving through. It was very concerning to her. Very few people had masks on, walking shoulder to shoulder, packed beaches. She said it felt like a light switch had been flipped overnight, and it was, largely, clearly up to individuals to maintain those social distancing parameters. What, if anything, is the advisory committee looking at to assure that once things are reopened here in Massachusetts, it's not a similar situation to Florida?
So clear communication from the state government down to regional, down to municipalities around what needs to happen to lessen the number of cases, to lessen the capacity or surge possible capacity on our healthcare system. We really did a great job during our peak of infection in Massachusetts, as far as not overwhelming, but certainly stressing our healthcare systems In Massachusetts, that communication starts at the state with some tools and funding from the state and hopefully federal government to the municipalities of how to keep that up, as well as basic PPEs for folks on Main Street, but also key sectors of our community, the support system, whether that's in community food pantries, daycare, eventually schools. The flipping the switch, I will speak to myself, for myself and my community. I wholeheartedly don't agree with any state that has opened more than Massachusetts. I find it to be irresponsible and driven by an economy. And while there's tremendous damage done to the economy with further shutdown and stay at home, the currency of doing that is not dollars, it's lives.